Okay, the first part of our discussion will be a prof-wise approach. We'll take first prof, that is then the second prof, third and then the final prof. What we will be telling you about are those subjects, and with the best of those toppers that we have, we'll just introduce you through those important topics that you should never miss in an exam. Dr. Ravi, I would just like to ask you about anatomy, that you might find those topics that are important.
Yeah, definitely. Anatomy is considered the phantom of all subjects because we've done some anatomy in the first prof and then we forget by the time we come to internship. So most people I've encountered, they first ask me what to do about anatomy and pharma. And as far as anatomy is concerned, first of all you need to be very clear that when you do anatomy system wise, you don't miss out on any arterial supply and any nerve supply of any region. You don't miss out on arterial and nerve supply. Then coming to individual topics. The first topic we'll discuss is embryology. In embryology, you should be very clear about the derivatives of individual regions, like system wise, which is derived from endoderm, which is derived from mesoderm, as well as a little knowledge about the neurocrest derivatives, the branchial arc derivatives. And one thing which you don't have to forget is the orbit. The embryology of orbit is very, very important. As far as every AIIMS exam, you get at least 2 questions from embryology, so you should not miss that part. The next topic is osteology. In osteology, I would like to say that it has to be a very selective approach. You focus on the types of joints, you focus on specific bones like sphenoid, orbit, mid-layer anatomy, a little about anatomy about the lateral wall of the nose, and a little idea about the ethmoid bone. Next, moving to histology. Now in histology, you don't need to read much, just the derivatives of different epithelium, which cover in embryology, as well as types of epithelium, especially the urogenital region. That is very, very frequently asked question in the exam. Then coming to head and neck. Head and neck is a vast portion, but still I would say, never miss cavernous sinus. The boundaries, the structures passing through it, and the tributaries and draining channels are the most important thing. As far as systems are concerned, one muscle, one region, you should not forget is upper limb. It's favorite for the AIIMS faculty, that the region of the shoulder joint, the muscles of the shoulder joint, the insertions, the actions, the muscles of the upper limb are very important. And the nerves associated with it, that's the reason they ask a lot of questions about brachial palsies. And another important artery to cover in upper limb is axillary artery. I always say never miss 2 arteries. One is axillary, one is subclavian. The individual parts, the branches which are arising from the individual parts are very, very important. As far as another system is concerned, I would like to stress on abdomen and perineum. Perineum is very, very, very important. You get a lot of questions on urethra, you get a lot of questions on rectum anal canal, as well as a lot of questions on ureter. So don't miss perineum, don't leave out abdomen. And if you want to read a little topic in thorax, you should focus on the blood supply of the heart and the structures passing through diaphragm. And to summarize, you never miss arteries and veins and nerves. So you also have to cover the dermatomes of upper limb and lower limb. I think so. That is what I feel is necessary in anatomy.
Exactly, Ravi. Do you suggest these things that you told about the nerve supply, arterial supply, embryology to be read by any particular book that you can just guide those first years that are stayed with us and those PG aspirants?
I read it from across. As far as book is concerned for anatomy, you can go for any book, any coaching notes, because the text is almost the same. Just make sure when you do the topics like nerve supply and dermatomes, it should be from an authentic reference. In many MCQ books, dermatomes have been given wrong. So you have to be very, very careful. So for that, I would suggest either you go take out selective picks from international grades, only the picks of international grades for dermatomes, upper and lower limb. Rest I feel you can read it from any other book as well as from your coaching books.
Thanks, Ravi. Amit, I think there was a question also this time in anatomy that you have various about the developments and all. Would you like to add those things that this time also I think Ravi points are very much emphasized by the name 15 question that was from embryology. Will you just add our students for that?
Yeah, as Ravi has very concisely given the points that are all to be covered in anatomy. Like for example, his stress upon embryology. So there was a question in May in 2015 only this time asking the derivatives of mesonephros. It was like the 4th option, which of them is not a derivative of mesonephros. So glomerulus, as we all know, it's derived from metanephros, not from mesonephros. So So I think we can all find a lot of questions on embryology and derivatives, like bronchial arches, derivatives of
terms, and as Ravi said, it should be read not from only from any guidebook. You should go and search yourself from those topics, and particularly the race anatomy is a very good thing to read about. I would just like to ask Zainab on this topic. Zainab, what would you like to suggest those who are in first prof first and those who are in intern as a different approach towards anatomy?
See, when you're in your first prof, you have a holistic approach towards the entire anatomy. You focus in depth about all the topics, right? So like all your mid-sems are like they're divided into different topics. So that way you do it much in depth in first year. But the problem is by the time you reach your internship, nobody remembers anatomy. So that time the topics that Ravi mentioned, just do those topics in order of importance from across or any other guidebook. You need not touch your textbook which you refer. Most of us do BD journals here. Nobody touches international grades that time. So maybe just look at the pics, or whenever you're doing your internship, just take an atlas while you're studying so that you have an approach that what you're studying for important regions like head and neck, the cranial foramina. There's a question in November 14 about a picture from cranial foramina. So if you read it in your first prof, there's no way you can remember what structures, which foramina is which. So if you have done it from a guidebook or an atlas, like from a guidebook with an atlas, so it helps when you are preparing for the visuals.
To this, I would like to add one point. As you mentioned, students should focus on some picture-based approach to question also. Like there was a picture of sphenoid bone given in our exam in November 14, and they have marked the various foramina. And they didn't label it, they just said A, B, C, D, E. So what are the following structures do not pass through, let us say, B. So we have to have an approach that what is the particular foramina, what is the particular bone or a part in the picture form. Because it not be theoretical. You may need to identify it first and then use the theoretical part. So at least have a knowledge about the basics of anatomy. For that you can refer any atlas.
And the problem is that most of the guides lack this.
It
is more of a theoretical approach. So if you could just supplement it with a picture-based approach, it becomes much easier also and much
and even visualization will also help.
Wait, would you like to just add on anything?
In anatomy as such, I feel that especially the first years, they need to go with a lot of a correlational approach towards anatomy. Say for example, like Ravi pointed out, embryology is a very important aspect of anatomy. So say when they are reading brachial arches, everyone knows that the second brachial arch structures are supplied by a facial nerve. So it is much easier to remember the nerve supply of structures when we correlate it with embryology rather than going for broad learning of mugging up the nerve supply. So anatomy has its own logical endpoints which we can try to attain in the undergraduate life, so that it's very easy to revise when we are going for entrance.
Exactly. That's a very nice point pointed by Vivek. Now we would just like to re-emphasize the importance of anatomy. Look friends, anatomy is one subject which if you score 100%. There are questions that you will make correct and the other person will also make correct. Now if you know stuff, you are correct. You cannot just mug it up. So be very concise in anatomy, and just we are giving you those topics or just Ravi iterated so that you can have a brief interview with